welcome to Medical Dialogues. I am Dr. Nandita Mohan, and today I will be taking you all to explore the world of rare diseases. And my topic for today is Fanconi Anemia. Now, to help us understand this condition, we have with us today Dr. Rajendra Paul, who is a distinguished hematologist in Baner, Pune, and he has more than 12 years of experience in the field and is one of the highly trusted hematologists in Pune. Now, Dr. Paul, over 20 years, has done over 5,000 autologous transplants, 1,000 allogenic transplants, and 55 CAR T therapies. He's also an expert in interpreting bone marrow biopsies and correlating with MRD and molecular studies pre and post allogenic stem cell transplantation. His expertise also lies in bone marrow hematopoietic stem cell transplantation. So, welcome to Medical Dialogue, sir. It's really a pleasure to be having you on board here with us today.
Thank you very much for the invitation. It's my pleasure.
Great. So now we're talking about Fanconi anemia, and we all know it's a rare disease. So if you could just firstly tell us what is Fanconi anemia, highlighting its primary characteristics, and also the main question, why is it considered a rare disease?
Yes, you're absolutely right. It's a rare disease, mainly characterized by bone marrow failure problems, like some patients initially come with anemia or cytopenia or even pancytopenia. And there has to be a high index of suspicion to make such a kind of diagnosis when you see the patients. It is a genetic one. It is autosomal recessive in nature. So when both the parents are affected as carriers, then obviously the child then inherits the disease, full-blown disease.
Great. Yes, definitely it is considered to be one of the important factors that one needs to highlight on. So now coming to the next aspect, what are the causes, if I may ask you in detail? And you mentioned it is a genetic condition. So how is it genetically inherited? Are there any criteria or anything that one must look into?
So any genetic disorder, like in this case, it's a random mutation in the stem cells of these patients. So the genes involved, there are many genes, more than 23 genes are involved. The most common are FANC-A, FANC-B, and it goes on and on. So these are random mutations in patients where it's only 50% affection. They are only carriers, not usually manifesting the disease signs or symptoms. But as we discussed, if both the parents have these carrier mutations, then the child who is born then carries both the copies and has a biallelic mutation, which means a full-blown disease. And the peculiar aspect is sometimes the disease may not be detected in the childhood, and they can be sometimes indeed very late in the presentation, in the teens or even second or third decades. So yeah, that is what about this disease. It's a very, very rare disease.
Yes, indeed it is. Now, what are the common signs and symptoms that indicate a patient may have Fanconi anemia?
So these patients, basically the symptoms and signs we need to consider. The symptoms are very non-specific, so we need to have a high index of suspicion. So symptoms are quite of variable nature. So some patients are having a short stature. Some have skin pigmentations, like we call them as cafe leaf spots. There can be malformations in the bones, the humeri or the long bones. There can be again congenital malformations in GI tract or genitourinary tract. So these are quite a variety of features, and they're not quite dramatic. But when these kind of patients come with any problems, the CBC, which is the first kind of indication when you should think of these disorders, then they can come with only subtle anemia, sometimes just macrocytosis, sometimes cytopenia and cytopenia and pancytopenias. So when we see such patients, we have to kind of marry the symptoms and the signs, and that leads to a high index of suspicion. So essentially, any patient which goes to any doctor, even for any cytopenias, if they are unexplained, then definitely these rare disorders need to be considered.
Great. Definitely it has to be considered. Now, you mentioned about the signs and symptoms, what one must look out for if they are diagnosed with Fanconi anemia. So coming to the diagnosis aspect, how is it typically diagnosed, and are there any tests which are specific to confirm the diagnosis of Fanconi anemia?
Yes. So initially they start with CBC problems, like mainly anemias or cytopenias. which should be monitored. And if it's persistent and is kind of unexplained, then they need further investigations. First and foremost is looking at the peripheral blood smear under the microscope, which can give us vital clues like macrocytosis, in spite of the hematinics being normal, or any other cause which normally causes macrocytosis is not there. But apart from that, if on monitoring we find that the cytopenias are persistent, then need further investigations. First is a bone marrow biopsy, which can give us more information on the findings of cytopenias. But the diagnostic test for these patients is the chromosomal breakage analysis studies. So what we do is basically their chromosomes, they are subjected to certain chemicals like epoxybutane, and we see how the genes of the chromosomes are breaking. So these patients' chromosomes break at a rapid rate, which is why they are quite susceptible to such kind of stresses. And that is one of the important diagnostic tests which can suggest that this patient is having Fanconi anemia. Recently, there are a few more tests, and these are basically NGS tests, next generation sequencing. But both these tests only come after the clinician has thought in the direction of Fanconi anemia.
Great. So, firstly, there are certain tests that are parametered to diagnose, and then once the diagnosis is reached, then there are confirmatory tests as well, as you highlighted. Now, sir, if I may ask, what are the common hematologic complications, if there are any, if you could highlight on that are associated with this disease?
So the cytopenias, initially, obviously, things are not clear, so it is monitoring. But after a period of monitoring of maybe 3 to 6 months, then we go ahead with further tests of bone marrow biopsy. Certainly, the main feature, what they represent is basically bone marrow failure, which causes bicytopenia or pancytopenia. Bone marrow failure is a term which we use for these patients when they exhibit these kind of cytopenias. So these are the features in terms of hematology for these symptoms. So these are only specific for hematology. There are extra hematological or non-hematological manifestations which come with a variety of signs, like basically they are quite prone for any kind of non-hematological malignancies like cancers of the head and neck area or oral cavity. Some patients come with cancers of the esophagus or any part of the GI tract or any part of the genitourinary tract. So we need to not only monitor the hematological parameters in these patients, but also screen them quite frequently for any symptoms or signs regarding these non-hematological malignancies by examinations and sometimes by periodic scans.
Great. Now, sir, we're talking about this in a lot of depth, and you mentioned about the various signs and symptoms, the diagnostic aspect as well. Now that we discussed about it, so my next question to you is, how does Fanconi anemia affect the bone marrow, and what impact does it have on the blood cell production? If you may highlight on it.
As we discussed, these are chromosome repair problems, the DNA repair problems. So these patients cannot repair their DNA once that's damaged. Normally, this is repaired by, normally there's a mechanism by which the damaged DNA is repaired. But these patients have a repair problem. That's why these bone marrow cells or the stem cells, they undergo early death, which is called as apoptosis. And that is why slowly over a period of time, most of these stem cells undergo early death, or that is called as exhaustion. So once this occurs at a consistent level, then they show features of bone marrow failure, which means they cannot then produce the normal amount of red cells, white cells, platelets which are there. So that's the main mechanism how the bone marrow failure starts. And over a period of time, there are a number of random mutations which occur, which then leads to further problems or evolution into high-grade myelodysplastic syndrome or even acute myeloid leukemia. So that is why that's why these patients should be monitored not only for their cytopenias or worsening cytopenia, but also to see if they're evolving into a high-grade aggressive MDS or leukemias.
Okay, okay. Now come, what are the treatment aspect coming to that part? What options are available for managing the symptoms as well as its complications for Fanconi anemia? What are the treatment options, if you could highlight on that?
So essentially, management would be to tackle two problems. One is the bone marrow problem, and second is the non-hematological problems like any other cancer of the head and neck area, etc. So hematological problems, the bone marrow failure, the only way of treating that is a bone marrow transplant, allogenic bone marrow transplant, which will cure the Fanconi anemia. But equally, there has to be a surveillance and screening of the other malignancies like head or neck area, which are a problem. That is why when they are on active monitoring, these areas, if any non-hematological cancers occur, they need equally treatment as well. So that is how we divide the management. In some unfit patients or old patients who are not fit for allogenic transplant, we can try the non-transplant therapies just to kind of prolong their survival. So that is mainly in the form of anabolic steroids. Latest treatment used in some trials is eltrombopag, which has shown some promising results in Fanconi anemia.
Yes, definitely. Now coming to the genetic testing aspect of this, so if you could just let us know what are the key considerations for prenatal or pre-implantation genetic testing for families who have a history of Fanconi anemia?
So first and foremost, it's a very rare diagnosis anyways. So such couples or partners should definitely refer to the hematologist at the earliest time point when they're planning for pregnancy. And for any genetic disorder, both of the parents should be screened for Fanconi anemia. So as I said, it's an autosomal recessive disease, and that is why we need to screen both the partners before any pregnancy planning is done. Side by side, they need to be seen by the consultants experienced in fetal medicine who can screen these patients during the early part of pregnancy or even antenatal period and provide genetic counseling with respect to whether to terminate the pregnancy or could carry on forwards if the child has not inherited the disease. So that's a very highly specialist kind of consultation, which should be happening with like in a joint hematology, obstetric, and fetal medicine clinic.
So all in all, it's a teamwork. There has to be a multidisciplinary approach to actually come to the diagnosis. And if there is a family history, then it's definitely genetic testing with a multidisciplinary approach will give benefits, will give definitive results.
Exactly.
So again, sir, how does Fanconi anemia affect the other organs and systems in the body? And if it affects, how are these complications managed?
So as I said, bone marrow failure is one part of the problem. The other problem is cancers of the other organs. So as I mentioned, head and neck cancers, cancers in the GI tract or in the genitourinary tract are common in these patients. So they need to be, every time when you see the patient, we also need to screen them for all these organs to see if they are okay or is there a malignancy in them. And obviously, if you do suspect, then they will need appropriate examination, blood tests, and scans to find the malignancies. It's best to identify these preemptively and treat them in the earlier stages for an optimal outcome. So we also need definitely a side-by-side a medical oncologist who will help us in managing the non-hematological malignancies.
Lastly, sir, if you could just tell us what are the potential long-term outcomes for patients who have been diagnosed with Fanconi anemia?
So in terms of outcomes, as I said, the commonest age of presentation would be in the first or second decade, and on continuous monitoring, once you see that the cytopenia is getting worse, then that's the ideal time for getting a bone marrow transplant. So bone marrow transplant is slightly tricky in these patients because they're quite sensitive to the usual drugs which we use in transplant, which is called as like the conditioning regimen and the radiation, because the inherent problem is the chromosome breakage or frail chromosomes. So essentially, we have to modify the pre-transplant conditioning treatment without using radiation for these patients for optimum results after stem cell transplantation. Having said that, if it's done in a proper way, the most recent figures suggest an overall survival between 70 to 85%, which is quite good considering the nature of the disease. So these procedures and obviously the counseling for those needs to be happened in a specialist center with a team who has experience, a lot of experience in conducting allogenic stem cell transplants.
Great, great. So as you mentioned, the success rate, if diagnosed early, then the success rate goes a long way. So it all comes down to early diagnosis and detection. And with the correct diagnostic measures and tests, one can actually come to diagnosis at a very early stage as well, isn't it?
Yes. Yes.
Great, great. So thank you so much, Dr. Paul, for joining us today at Medical Dialogues and giving us all your insights on Fanconi anemia and telling us in depth, in detail about what it is and what one needs to look out for, what are the signs and symptoms and everything in detail. So thank you so much for joining us today at Medical Dialogues.
Yes, no problem. Thank you very much.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.